You listen to Mistreated. I'm Nam Kiwanuka. Back in October, the McKinsey Health Institute published an analysis that showed how women's health and productivity in the workplace are, quote, deeply interconnected. It examined how addressing the gaps in women's health would benefit the Canadian economy, especially outside of so-called bikini conditions. The report states, quote, globally, sexual and reproductive health and maternal, newborn, and child health account for only 5% of the women's health burden. But when you look at the health of Canadians, more than half of the top 10 health issues impact women differently or disproportionately. And a lack of research leads to worse health outcomes for women. It's startling to see this data, so to put it all into context, I spoke with one of the report's authors, Marie-Renée B-Lajoie, who says this is a starting point to address the problem, but there's a lot of work still to be done. Take a listen. Marie-Renée, welcome to the podcast.
Thank you. It's such a pleasure to be here, Nam.
Could you please introduce yourself and what it is that you do?
Absolutely. I'm Dr. Marie-Renée B-Lajoie. I'm a partner with McKinsey Company here in Canada, and I'm also a practicing emergency physician and co-author of McKinsey's Closing the Women's Health Gap in Canada, a $37 billion opportunity.
I was so excited to see this report. After speaking to so many women, there's this feeling of personal failure, of not being able to push through health challenges. And there is a real fear of losing work opportunities if you speak about these issues in the workplace. How is the health of women in Canada tied to the economy?
It's so critical. And Nam, this is so compelling the way you're starting the discussion. I just want to say I was always moved by my grandmother who would tell stories of getting the right to vote, and my mother, entering the working profession and really pushing for us to have financial and professional independence. And we are lucky in Canada. We have the privilege to work as women. But it's very clear now that if we want to push the gender parity agenda, we absolutely need to discuss women's health. And that means making sure that all of us have access to the best care and have access to the most efficacious treatment to be able to unlock health for us.
What did the report find?
Well, I wish I could bring good news. I certainly bring news that calls for action. So the first thing that we found is that, in fact, women's health issues defined as sexual and reproductive health are less than 5% of our gap in Canada. So when we think of women, and some people will coin bikini health, that's a really small part of what drives the gap. In fact, cancer, cardiovascular disease, and brain and mental health are really what impacts most Canadian women. And if we were able to solve the top conditions, it could give back a full week of health for all Canadian women. So let's that sink in. For the 20 plus million Canadian women, if we were able to address this gender gap, all of us could live across our lifespan one more week of health every year. So that is really critical for Canadian as a whole.
You mentioned the bikini conditions because when it comes to women's health, I think most of us understand that, it has to do with like the breast area or the reproductive area. But then we're missing out all of these other conditions. And your report actually highlights that women in Canada spend 24% more time in poor health than men. That was a shocking statistic for me to try to wrap my head around. Could you talk a little bit more about that?
Absolutely. And frankly, it's heartbreaking, right? When you actually look at the numbers and the fact that all of us combined will experience poor health at that scale is absolutely groundbreaking. And I just want to acknowledge the fact that also men experience poor health is terrible, but the fact that women will live it outside. And one critical point, Nam, that I want to make is we often think of that because women live longer. Therefore, we have poorer health overall than men. But the truth is, it will happen all throughout our lifespan due to the different conditions we were discussing a minute ago: cancer, poor outcomes in cardiovascular health, higher rates of depression, anxiety, obviously, and there is hormonal health, the impact of menopause, puberty, chronic pelvic pain. There's a lot of these other conditions that compound and will make that we as women will experience health very differently, and that will have meaningful life on our ability to contribute to society, to contribute to our families, to contribute to our own lives, right? And that is really critical and needs to be talked about.
I, when we talk about women spending more time in poor health and this idea that, well, women live longer, so therefore they're more healthy. And again, going back to that personal failing, like you're supposed to push through the conditions. But then we think about the fact that women weren't included in clinical trials in the US until 1993, in 1997 in Canada. Because your report outlines that women's health and productivity are, quote, deeply connected. In what ways?
So the first thing I want to say is our report highlights three main gaps. The data gap, which is exactly what you're hinting to, Nam, is not only do we have not collected the data, we just don't know. So, Health Canada does recommend to include women and look at sex disaggregated data, but there are no enforcement mechanisms. So today, when researchers in Canada, it's a nice to have. So how do we think? And in fact, I would argue the US has done more on enforcing some of those facts. So addressing the data gap as a first gap is critical. And then there are two other gaps. The second gap, the efficacy gap. When you start unpacking when there is data, there is evidence that asthma medication may not work as well. Certain treatment and geography, so the stents that people get in their heart when they have heart blockages may not work as well for women because of the nature of their diseases. When you start unpacking all these conditions, these things compound. So not only once we have access to these great treatments, they don't even work as best as they can for us. And then third, there's the care gap. Are we really getting the care pathways that fully change the way as women? So how do we think of hormonal transition impacting, postpartum impacting depression, menopause impacting insomnia, anxiety, other mental health issues, and then our longer term arc on, dementia, cardiovascular risk. All these things are deeply intertwined. And I think, to your question, Nam, of how do we then tie this to productivity? Well, as I said earlier, this ties directly to our ability to contribute because unfortunately, we might not be able to show up to work as we should. And if some elements are not in place, well, we may not have the levers to stay in the workforce. And furthermore, we are often the caregivers to others in the society. So when we are not at best, we are not the most, impactful that we can be in our lives and the lives of others.
Earlier in the season, we spoke to Amber Mack, who's an entrepreneur, and she's a tech leader. And she was saying that Canada is, we have these conversations about productivity. And right now, the big push is AI can solve these productivity issues. And then she said, well, wait a minute, because Amber Mack was talking to me about her journey with fibroids, a condition that isn't studied. And she was telling me how it impacted her work and the concessions that she had to make. And she said, the answer is not so much AI, but to focus on women's health. Can you talk to me a bit more about how this impacts women in the workplace?
Two big levers to address this are expanding women's participation. So making sure that women, because they are healthier, can then actually come to work. So that's step one. And then step two, when we are at work, that we can be as productive as we can be, right? So this is really critical for us to be able to then, be able to show up, as I mentioned earlier. And there are critical levers on how, both, as I mentioned, the efficacy of intervention and then the care that we get that allows us to come back in the workplace at the right time. But I think an underpin element that needs to come with this that, the colleague you interviewed mentioned is really the data gap. We just don't know because these conditions are not studied, these interventions are not pursued and invested in. And therefore, we do not have access in any meaningful way to these things that can unlock our productivity in the workplace. So this is really critical as we think of us showing up. There's a lot of different levers that need to be pulled. What is the employer putting in place to really enable this? What is the care that you're giving? And, is the innovation ecosystem helping us develop the solutions that will help us have the care and then be able to then our employer make sure that we have access to that care? So these are very complex, intertwined elements. And one of the case that we make in the paper that I think many women's health advocates in Canada are making now is that means we need a coordinated, accountable national health strategy for women's health in Canada. As a strategy consultant, when you have complex strategies that mean a range of stakeholders with a lot of different levers to pull, we need to come together. We need to coordinate because the economic uplift for our country and for women's themselves is major.
What would that strategy look like?
Yeah, it has multiple levers. So, as we discuss, right, if we think of the different gaps, the first aspect is around research. Currently, data suggests that about 6.8% of Canadian research is focused on women's health. That is minuscule.
That's like a percent. Yeah.
No, exactly. So one of the first step is making sure that we are funneling sufficient dollars into research, and that means our pan-Canadian research institutions to the Canadian, Institutes of Health Research, but it's also philanthropic dollars and, innovation dollars into the research and the trials. Then it's making sure that whatever research we do, as you already mentioned, have enough women in them. We know dementia is a condition that disproportionately affect women, yet we are still underrepresented in clinical trials, and the solutions emerging are not as efficacious for women. That can't continue. This is done, right? So as we think of the research, we need to hold researchers accountable to make sure that the representation is fair. And frankly, as we're looking at the data and in all transparency, we are working on a much detailed blueprint for action, and the data is clear. We need more female representation as researchers, as clinicians, to advocate for that in, editorial board of research papers, making sure that things get published and incentivized. So all of these things is tied around this data gap, right? We mentioned the efficacy gap. Well, there's a huge role there for our innovation ecosystem. How do we think of the different holders? That's obviously government, industry, private capital. How does this all come together to really raise the bar in Canada? VC money continues to trail in Canada, right? So we need to be able to then come together. Obviously, there's a role to philanthropy as well, to really kind of jumpstart this and say, we will have a commitment. And as women, how are we investing, right? And what are we demanding of our investment channels to then be able to move that needle? And then finally, the care pathway. There's definitely a lot of work thinking about medical education training, thinking about, care clinics, and us as women engaging with our healthcare providers and new solutions. Frankly, it's really exciting to look at the femtech and the health, women's health ecosystem, and many others are way better than I to speak to the details of those. But how do we use that to make sure that women are getting the care they need when they need it? So as I mentioned, that strategy has a lot of pillars, and that's only as working together as Canadian, coming together, coordinating, defining a few set of really key levers that we want to move. I think there's economic outputs that we want to track. There's KPIs around, women employment, employer engagement, industry investments. There's a lot of things we need to measure that are critical as part of this strategy.
I'm glad that you mentioned femtech. We're actually going to be covering that in the next episode. I think if you live in Canada or even just globally, Canada has been thought of as a feminist nation. Your report highlights that Canada ranks among, quote, the top 10 countries globally for gender equality. But that doesn't mean that women's health is a priority. How do we fare up when we think of other jurisdictions that maybe are doing it better?
So Canada has the fifth worst gap on women's health in the world. But there's a very subtle nuance here that I think you'll appreciate. The reason our gap is so high is because as women, we are a very active part of society, especially as it means in terms of workforce. There's a lot of countries out there where women are still part of the informal economy, right? Therefore, the gap as measured using a GDP output will appear much smaller. So what that means is Canada is worse because we are working and therefore we are bearing the consequences of that women's health gap even more sharply because us as women, we are not able to show up in the workplace as we could. In addition, as I said, to the benefit of being healthy. So I profoundly believe, and that's one of the reasons McKinsey and the McKinsey Health Institute and our range of partners here are so deeply committed to this. Canada can lead the global blueprint on how to fix this. There's no more important time in the current, world context that we can rise and we can say, look, the frontier of voting, done, check. Financial and professional independence, I mean, we're still working on it, but much better. Women's health is something we as Canadians can unlock, push, and develop and show the way so that all women globally can benefit.
And the thing I think a lot of us learn from firsthand experience is that if you don't have good health, it actually impacts your ability to have that economic freedom. We always look for solutions on this podcast, and the framing of this report is that this is an opportunity. This is a $37 billion opportunity. How do you come up with that number? And how, if you could just explain to us more how this is an opportunity for Canada in this time right now.
I'm so aligned. I'm all for solutions. And I know sometimes these numbers can sound wildly depressing, but this is a call to action. And this is a movement that we as Canadian women who now have the professional and the financial independence can really move on. We are making choices, and every day we can make different choices as we discuss with our employers, as we discuss in our investment portfolios. So this is really something that is so critical. And I love how you're framing this, Nam. To your specific question on the economic analysis. So we broke down the economic output in 4 buckets. And I think that's a very important nuance, because what I will say is showing that it's only these 4 buckets. There's actually more. So when we say 37 billion, it's at least 37 billion. So this is only the beginning. So the 4 buckets are, as I mentioned, expanded participation. So making sure that women who today may not be able to enter the workforce because of health issues, be able to enter the workforce. That's 1. 2, increasing productivity. So when we are in the workforce, we can show up at our best and feel confident and be able to pursue the career that will give us higher income potential and higher impact as we want, right? So critical piece number 2. Number 3 is making sure that, we have fewer disease. We are healthier, and that has economic value to the broader society. So decreasing these conditions really matter. And that has 4 consequences on we don't die as early. We will live longer, healthier life. And that too creates tremendous value for our society. So the buckets that are not included in here are, what about the new market opportunities? You've mentioned chronic pain, fibroids. There are new market opportunities being created. If you think of the growth of the femtech industry, these are brand new industries that are growing, that have enormous economic potential, and that in Canada could make a huge difference in our innovation ecosystems. That is not in the economic potential. So Canada has at least a 37 billion, and we can make the choices to influence that.
I can't thank you enough for creating this report, because I think it's going to make people stop and think about how all of this stuff is connected. It's not just, well, you just need to get out of your head, you just need to be stronger, you just need to push through the pain, that this is actually connected. Everything is connected in our economy. Is there anything that I didn't ask you that you wanted to mention?
Thank you so much, Nam. This is only the beginning. There's a lot of work to be done, but each of us have a role to play in how we're talking about women's health. This is not just a side conversation and a nice to have in the bottom of a, cocktail party. This is something that as a society, as women, we can move the needle on. So as we think of our choices, how we're investing, how we're engaging with our employers, how we're contributing philanthropically to a Canadian society and giving our time back. These are all places that our choice can meaningfully advance the agenda and come together under this coordinated, accountable strategy to make Canada one of the leading countries in the world.
Marie-Renée, thank you so much.
You bet.
This was Mistreated. Thanks for listening. You can follow our show wherever you get your podcasts so that you can get notified each time a new episode is available. We would love to hear your feedback. You can write me an email at mistreatedpodcast@tvo.org or reach out to me on my social channels. Let us know if you like this type of shorter content that breaks down women's health issues through reports, studies, and surveys. We liked producing it. Thanks so much for listening.